Welcome to our discussion on African swine fever, what you need to know. Thank you for joining us. I'm Dr. Jack Shere. I'm the Associate Administrator for USDA's Animal and Plant Health Inspection Service. I will be moderating the discussion today. As many of you know, African swine fever is a highly contagious, deadly pig disease. It has already devastated the pork industries and economies around the world, and if detected in the U.S., it could ravage our swine population and our nation's pork trade. USDA's Animal Health and Plant Inspection Service, or APHIS, has launched a new awareness campaign called Protect Our Pigs in support of the commercial pork producers, veterinarians, pig owners, and hobbyists, because you are among the nation's first line of defense against African swine fever. This event is part of USDA's effort to fight African swine fever. For today's discussion, myself and leading experts who have been watching this disease for many years will provide an overview of ASF. We'll detail how transmission occurs and what you can do to prevent ASF from spreading on your farm, and discuss the signs and symptoms of the disease. Finally, we'll talk you through how to report cases of ASF and answer questions from the audience. Please note that this panel is being recorded. If you'd like to come back to watch it again, it will be made available at www.aphis.usda.gov/protectourpigs. Now, I'd like our panel of experts to introduce themselves.
Good afternoon. I'm Anna Forseth, a veterinarian and Director of Animal Health with the National Pork Producers Council. Our NPPC team represents pork producers and 42 affiliated state pork associations. I help oversee pre-harvest animal health and welfare issues, which includes foreign animal disease preparedness. I'm a Montana native. I grew up on our family's farrow-to-finish swine operation. I received my bachelor's degree in animal science from Montana State University, my doctorate of veterinary medicine from Colorado State University, and a master's degree in veterinary preventive medicine from Iowa State University. Thanks to the USDA team for inviting me today.
Thank you, Anna, for being here today. And our next panelist is Jamie Eggers.
It is my pleasure to be here today. Thank you. I am Jamie Eggers, the Producer Education Director at the Iowa Pork Producers Association. In my role here at Iowa Pork, I help pork producers with all their needs related to swine health and production, animal well-being, research, and innovation. Most importantly, for today's discussion, I help them with all things foreign animal disease preparedness. I have a bachelor's degree and a master's degree in animal science, and together with my husband and our son, we are the fourth and fifth generations on our diversified family farm in central Iowa, where we raise corn and soybeans as well as have about 100 sows.
Thank you, Jamie. And our next panelist is Pete Tomy.
Good afternoon, everyone. As mentioned, my name is Pete Tomy. I am a swine producer located in southeastern Minnesota, where I farm alongside with my dad and two older brothers. We are a family farm, farrow-to-finish operation, along with row crop, where we raise corn and soybeans. Some of my daily responsibilities as a swine producer on a daily basis are daily pig care, checking the health of our animals, and working with our employees and custom growers that raise and care for our animals. One of my core responsibilities is working closely with our veterinarian to monitor the health of our animals to make sure that everything is managed and taken care of as it should be in a routine and humane manner. I received my Bachelor of Science from the University of Wisconsin, River Falls, majoring in animal science and agricultural studies. And thanks for having me today.
I'd like to thank the three panelists for their introductions and for being here today. What we're here to talk about is ASF and why it's a concern and what's at stake. When you consider that the U.S. is one of the world's largest pork producers and the second largest exporter of pork globally, if this disease were to arrive here, it's estimated it would cost the U.S. $50 billion over the course of 10 years to eradicate. The U.S. moves about 1 million pigs a day on the road to 17 different states. So you can see how if this disease was introduced, how rapidly it would spread. It would affect not only the swine industry, but all ancillary and associated businesses. And some estimates say that as much as $80 billion could be affected. What the USDA has done is to invest over $500 million to prevent the spread of this disease and enhance our surveillance, testing, and response preparations in the U.S. mainland, Puerto Rico, and the U.S. Virgin Islands. And it's working with other nations to mitigate the virus, namely Hispaniola, the Dominican Republic, and Haiti. USDA is working every day to stop this disease from breaching our borders. We're doing many things. We're working with Customs and Border Protection. We're working to eliminate feral hogs, both in the U.S. and in Puerto Rico. We're creating active and passive surveillance plans in the United States and Puerto Rico. We're looking at slaughter surveillance. And we're doing the development of testing and eradication programs and different products that we could use in the U.S. through testing programs that we're working on in the Dominican Republic and Haiti. We know that our commercial pork producers and veterinarians and pig owners are among the nation's first line of defense, and that is very important against African swine fever. To further support the work that these folks are doing in the fight of African swine fever, APHIS launched the Protect Our Pigs initiative to provide the most up-to-date information on ASF and provide free resources. You can go to the Protect Our Pigs website, www.aphis.usda.gov/Protect Our Pigs, to learn more about ASF and print materials. Over the next several months, the site will continue to be updated with new materials and resources to include such things as downloadable fact sheets and posters that you can hang at your facilities, instructions on how-to videos, one specifically designed for pork producers and one for veterinarians, shareable social media graphics about spotting signs and symptoms of the disease and how to report it, a new interactive biosecurity guide that walks you through key prevention steps and biosecurity plans that can be used to help train outside personnel or on-site personnel and staff. Both of these measures are very succinct and friendly for viewing on such things as phones and small devices. You can also sign up to receive emails with the latest updates about African swine fever. If African swine fever is detected in the U.S., we will also be ready to respond immediately with actionable information and resources for pig owners and the public, which will be posted to the Protect Our Pigs APHIS website. Now I'd like to ask Jamie to discuss transmission and how the disease can spread on the farm, in a facility, or in the backyard. Thank you, Jamie.
Thanks for that question. I think it's important to remember that African swine fever is a disease of pigs. Humans cannot get African swine fever, and pork is safe to eat. I'm going to talk about how African swine fever is transmitted. And I'm not a veterinarian, but fortunately we have two on this webinar that can answer your questions about the details of disease transmission if you have them. African swine fever can spread to pigs in 3 different ways: through direct contact, indirect contact, and via insects, specifically soft ticks. Spread of African swine fever by direct contact means healthy pigs have nose-to-nose or other physical contact with infected domestic or wild swine. This means pigs could pick up the disease when at a swine show or are interacting with any wild pigs that are outside their pens. When these sick pigs have direct contact, they may spread the virus to healthy pigs through their infected saliva, urine, or feces. Indirect transmission of African swine fever happens when healthy pigs eat virus-contaminated feed or pork products. That's why we see USDA working hard to keep pork products from coming across the border, especially from countries that have African swine fever. But this can also happen if a friend or neighbor processes pork from an infected pig and then shares the pork with you, and then any leftover pork is fed to the pigs. Also, though people cannot get African swine fever, they can spread the virus to your pigs if you don't practice good biosecurity. That's because they can transport the virus from infected pigs and still be wearing contaminated clothing and shoes, using contaminated equipment or vehicles, or the contaminated food waste when they have contact with your pigs. Finally, African swine fever can be spread to pigs by some insects. This type of insect transmission can occur when a soft tick acts as a vector, meaning the tick feeds on an infected pig, then spreads the virus to a healthy pig by feeding on it. Soft ticks are found in the southern United States.
Thank you, Jamie. That was great information. We're going to move on to Pete and ask if he could talk to us about what pork producers like your family are doing to prevent spread of ASF and implement biosecurity best practices. Thank you, Pete.
Thank you, Dr. Shere. Yes, I think one of the most important topics as an industry that we can educate ourselves on is biosecurity at the farm level. And in today's discussion, I think education and awareness are two of the important messages that we should try and make sure that we're getting across to the general public, but also us as producers. Biosecurity implementations within our farm, but pretty standard across the industry on a daily basis, are shower in, shower out of facilities at each barn to make sure that we're not transmitting any diseases, or if one group of pigs is sick, that flu or something gets passed along to another barn. Each barn has a designated set of boots and clothes that stay in the office or at the barn to make sure that no fecal material or other forms of transmitting a disease between pigs is carried or moved around within our operation or within the industry. We do weekly sanitation of our vehicles that we drive on a daily basis to make sure that we sanitize, clean floor mats, power wash the outside, the tires, because our neighbor might raise pigs for somebody else, and making sure, whether we did cross paths or not, that we're not dragging things amongst the countryside. We implement strong biosecurity in regards to the feed mill that delivers our feed. Those trucks are washed on a daily basis as they come to our farm, but then go to the neighbor's farm. But also in regards to feed mills, the ingredients and the suppliers and vendors that provide those ingredients, making sure that we have strict biosecurity and testing of those feed ingredients before they go out into the countryside, that they are within a certain amount of days of quarantine, or before that they are shipped to the farm gate, is most critical as a producer to make sure that my P's and Q's from those folks are done correctly. In regards to transportation of animals from farm to farm, sanitizing, power washing, making sure trailers and transportation of these animals are sanitized and in a clean manner from group to group, or each time a load goes to a packing plant, making sure that trailer is clean before it comes back to our farm is absolutely crucial to make sure we don't bring any disease that might be from another farm, or ASF, if it was to be introduced into this country, that it wouldn't be drugged back to our farm. I think it's of most importance as we go through this process as producers, to making sure that people understand that 90+% of swine operations are family owned in the U.S. So it's the same people that you meet at the grocery store, go to church with, are local members of your community. And people don't care how much you know until they know how much you care. And we as producers care about our animals and the welfare that we provide them day in and day out. And there's many different ways to raise swine in today's industry, whether that be a larger commercial operation or a backyard hobby. But it's very important that whatever size and scale that you are, that we're all on the same page when it comes to ASF and practicing these biosecurity protocols, because we are on the same team, and making sure that this, if it is introduced, it does not spread amongst our herds, and making sure, 4-H, FFA, jackpot shows, those types of things, smaller herds are practicing these biosecurity protocols on a daily basis, just like we do in regards to a larger commercial operation. So this is a challenge that we are facing as producers, and it does keep us awake at night, because, as mentioned, it could be up to 50, if not $80 billion impact to our industry within our country. But a swine industry in general, it could be an $8 billion production and industry impact per year if ASF was to get here. So again, education, biosecurity, educating your employees, working with your veterinarian are all very crucial things on a daily basis. Just like we tell our employees, safety is number one. Safety does not take a day off. Well, neither does, biosecurity. So making sure that you're implementing and don't blink is crucial. So, something to take very seriously. And again, thank you for the time. And again, education and awareness is very important as we launch this and try to educate the general public.
Thank you, Pete. We often hear that biosecurity is expensive. We know that disease is more expensive, so biosecurity is often worth the investment. Next, I would like to hear from Dr. Forseth. Dr. Forseth, we know that African swine fever is a tricky disease to detect, as it can look like many swine diseases. Can you please talk to us about the most common signs and symptoms of ASF and what folks today should be aware of in regards to their herds, and how veterinarians can work with hog producers and farm owners to mitigate the disease and the risk of ASF? Thank you.
Yes, thank you, Dr. Shere. Before talking specific signs and symptoms, I think it's important that producers understand that the clinical presentation of African swine fever can vary and can be influenced by a variety of factors. The strain of the virus can influence the virulence, and some strains can cause much more severe acute disease than other strains. We have seen this to be true in recent outbreaks in both Asia and Hispaniola. And as we learn more about African swine fever, we understand that it may not necessarily present as cases of very high mortality very quickly. So regarding the clinical signs, there are several that producers should be watching for. These include high fever, decreased appetite, weakness, lethargy, red or blotchy skin lesions, GI symptoms such as diarrhea or vomiting, respiratory issues, including coughing or difficulty breathing. The mortality rate can vary, but can be up to 100% of infected animals. Notable necropsy findings may include an enlarged spleen or varying degrees of hemorrhage in the lymph nodes or the kidneys. African swine fever can mimic domestic diseases, including PRRS and Salmonella. So it's important that situations where pigs have signs consistent to ASF, even though they're also consistent to domestic diseases, are reported to a veterinarian. And then that veterinarian will work with state and federal animal health officials to determine the need for further evaluation and possibly diagnostic testing. Quick thinking and communication by producers is what will be required for quick detection of this disease. And it's going to be critical that we detect it quickly to prevent a large outbreak. And a final comment regarding diagnostic testing. Just so everyone is aware, there is background surveillance testing that's currently underway for both African swine fever and classical swine fever to help support this goal of early detection, along with increasing laboratory testing capacity and an increase in the number of approved sample types for African swine fever detection. So producers, if you see something, say something. Don't just assume it's not a foreign disease. Talk with animal health officials, your veterinarian, and work with them to determine whether or not a diagnostic plan is needed.
Thank you, Dr. Forseth. We know that early detection is critical to stop the spread of ASF and to contain it. If you suspect a case of ASF in your pigs, please report the signs immediately. You can do that by contacting your state or federal veterinarian's office or by calling USDA's hotline at 1-866-536-7593. Now we're going to take questions from our audience. We apologize if we do not get to every question, but please feel free to add it to Facebook and we'll do our best to respond to each question. First question is for Dr. Forseth. How do I know if infection is in my area? What do I need to do if it is?
Good question. To the first part of the question, how will I know if the infection is in my area? The state animal health officials and USDA will be working to notify producers. In many cases, while waiting on confirmation of a diagnosis, they will already be identifying producers within the surrounding area, which we will call the control area. To the second part of the question, what will you need to do in the event that you are in this control area? Again, your state animal health official will also be providing you with direction here. There will most likely be specific testing, surveillance, permitting requirements of those who are in close proximity to the infected site. So animal health officials will make it a priority to notify these individuals quickly and provide this information to them. If I could just maybe add a couple additional points. In general, producers should be aware and prepare for a 72-hour standstill of swine movements, which is most likely going to happen after the initial diagnosis of African swine fever. And that's regardless of where the first case is. So if the first case is in a separate state to where you are, you still will likely be impacted by this 72-hour standstill. If a case is near your farm, you will also likely be asked to share information with state and or federal officials regarding animal movements, as well as movements of feed or equipment, personnel, or visitors. So if you're not keeping track of this information, you should start. It'll be pretty important for their efforts to try to trace where the disease may have come from and where it has gone. I would also like to add quickly that there are certainly things producers can do now to prepare and lessen the impact to their site should they not be infected with the disease itself. First, I'd encourage everyone to get to know your state animal health official. Reach out to them, attend conferences or meetings where they may be presenting and ask questions of them. You may also find out if they have a notification system for your state in place, such as a text alert system that may allow you to be notified immediately of a situation like a foreign animal disease detection. Second, if you haven't registered for a premises ID number, I would strongly encourage you to do so. And then third, talk again with your state animal health official or your state's pork association about opportunities such as the Secure Pork Supply Program, the Swine Health Improvement Plan Program, and the Certified Swine Sample Collector Program, which focus on business continuity, interstate commerce and trade, and disease surveillance, which are all very critical components to a foreign disease response. Thank you for the question.
Thank you, Dr. Forseth. Our next question is for Pete. Pete, I hope you can answer this question. Why should all pig producers care about ASF?
That's a great question. I guess how I would tee that up is all pork producers should care about ASF because I think similar to COVID, ASF is not going to discriminate. It's going to go after, it can go after any type of producer, whether you be a hobby producer, a custom grower that feeds for an operation, or you're a commercial producer within the swine industry. So we should all care about this, regardless of your size and scale. Why should we care? What it could do to our industry from a production and economic impact to our industry could be catastrophic. We've seen what it did to China's swine production and their swine herd. They're still rebuilding almost 5 years later after ASF was introduced to their swine herd. What it would do to our U.S. exports would just cripple our industry. If we can't export our safe, nutritious pork that we do on a regular basis, but yet alone what it would do here to our markets would be, again, crippling. And then we should care, again, about the education and the message of ASF to the general public and what the media may portray of ASF. So I think it's very important that education and the message from all of us, regardless of the size of our operation. Thank you for the question.
Thank you, Pete. We also have a question for Jamie. What can I do to make sure that my pigs don't get ASF?
Thank you for that question. And I think we should note that Pete did a great job of talking about ways that they protect their pigs and the emphasis on biosecurity in some of his discussion. So I'm happy to talk about some other ways that producers can protect their pigs from African swine fever and share some examples from our farm. The first is by limiting their contact with other pigs, wild or domesticated. So the pigs on our farm are housed indoors, but for outdoor housed pigs, it's important to make sure the fences are solid and not allowing pigs to have contact with other wild pigs. The second way producers can protect pigs from African swine fever is by not feeding food waste, especially that containing meat, to their pigs. Our pigs eat a traditional corn and soybean balanced swine diet, but for other farmers that might be utilizing some other alternative feedstuffs for their pigs, ensuring there is no food waste in there, especially that with meat. The third way is by practicing good biosecurity, such as having a dedicated set of clothing and boots that's only used around those pigs. Pig owners should not share equipment, such as buckets and feeders, with other pigs, and make sure anyone visiting their farm or pigs has not been around other pigs and wears coveralls and boots specifically for that farm. And lastly, by very closely monitoring pigs for any signs of sickness and notifying a veterinarian if they have any concerns.
Thank you, Jamie. Looks like I'll field this final question about the national stop movement and pig movement controls in a control area. Question is, how will that affect the meat locker where I bring my pigs for my use and for my sale? Will I be able to sell the product that is already there? How will the locker know if it gets a pig with ASF? Quite simply, as Dr. Forseth has told us, when ASF is detected in the United States, there'll be an immediate 72-hour stop movement. During that stop movement, pigs on their way to slaughter will be taken to slaughter and processed there. As part of that stop movement, any pigs that are at a location, meaning still at the farm, will not be allowed to move. Trace ins and trace outs will be done. By that I mean if we'll go out from the farm where we detect the infection and trace any movements of pigs that were sold out of that farm and any movements that came into that farm, as well as movements to slaughter and sale. Now, as we've also talked about, this meat is perfectly fine for consumption. So that meat will be processed and will be consumed. But if there's a trace to it, to a plant, a slaughter plant, we will definitely designate that meat or figure out where that meat is and where that process is, and designate it as possibly infected with ASF, so as not to be fed back to in any way, shape, or form, or processed into any product. The offal is also important, meaning any of the internal contents of that hog. Will be wanting to find out where that went and what process that is under. So there's several steps in the containment of this disease, and that 72-hour stop movement is just the beginning of us trying to find out where the disease is and where the disease isn't. So our big challenge will be, can we get that amount of work done depending on the degree of spread in that 72 hours. So that's a partial answer to your question, but that's the best we know at this time. I'm afraid that's all the time we have for today. Thank you again for joining us and working together with us to help fight African swine fever. If you'd like to come back to this event, it will be available at www.aphis.usda.gov/protectourpigs under the Spread the Word tab, or go to Protect Our Pigs for more resources on the APHIS website. I'd like to give our panelists a chance to say goodbye and thank them again for their time and participation in this event.
Thanks so much for everyone's time today. It's been an absolute pleasure to be here with my fellow panelists. Thanks for spending some time with us and finding ways to protect our pigs from African swine fever.
Thanks for having me today, and it was a pleasure to speak on a few topics. Hopefully everybody that queued in, thanks for your time joining, and you were able to take, even if it's just one thing away from today's discussion, that's a win. Thank you.
I echo Pete's comments. Thank you all for your time today, and just ask that you all please continue to stay alert.